Okay, healthcare part two here. First video is just posting up right now, but I just sort of wanted to expand on, you know, my thoughts and ideas on this. But again, I think it needs just a whole new line of thinking here. It needs to be. Some terms have been used, universal or single payer, but it needs to be one, agency administering this whole thing. All of the money goes into one pool and is used to provide the service. It can't be going into 200 pools. It needs to go into one that covers the whole country. So that would bring it down to single payer. The money technically, instead of all of the other aspects of everybody physically buying, it's part of our taxes. I mean, we have to pay it anyway, so just make it part of the taxes. Have it come out, and let's forget about the idea that government can't do anything. Maybe they haven't proved maybe they've been working hard to prove they can't, but I don't believe that can't change. So perhaps you look around and you say, who's doing this now? Well, it's insurance companies. Insurance companies are the ones that are basically managing what medical system we have. So why don't we look around and find out what insurance company perhaps is the best at doing this? So we could make a whole new agency, patterned after the best model. But on the other hand, why might we not just say, and this is going to sound pretty socialistic here, however, why don't we just say, you know what, in the case of healthcare, it's just something we need to provide for everybody. It needs to be non-profit, and so why don't we just nationalize? Oh my God, why don't we just nationalize one of our insurance companies? Everybody still wants their job. Everybody's making money. Their salary. So why don't we just nationalize it and say, okay, you guys are now the National Health Insurance Organization, or whatever you want to call it, and that's what you're going to do. But you're not going to make a profit anymore. It's for not for profit. So currently, everybody pays money into the insurance companies who make a huge profit. So doesn't that mean there's lots of extra money there? All of this money is going in already anyway. So why not just use it all for what it's meant to be, and that's directly to provide services, no profit. We still build hospitals, contractors still make money, designers still make money. Everybody makes what they made before, but there's the hospital itself does not make a profit. So it would seem to me that with a combination of making sure that in some cases things aren't being overcharged, but that things are running efficiently, there's no profit involved, that we should have enough, again, funds available to provide the service. And as time goes by, we strive on getting even better. So it seems to me that would be totally doable. But we just keep saying, no, we can't do it, no, it won't work, without even trying. And then, of course, the subject has come up over this great debate over the last couple of years about the death panels. Oh my God, the death panels. Well, right now, the death panels are the insurance companies. Don't they say yes and no on procedures? That would not change hardly. I mean, maybe we make it better, but to think there are no death panels today is a joke. We can find tons of stories, horror stories of coverage denied for this reason or for that reason. I think it's widely accepted that the insurance company's standard procedures are to reject you. And if you fight it, then you might get it. So anyway, so I don't see any real difference there. So I'm just sort of going to say death panels, we have those already. Let's try to eliminate them, or at least make them better. But they're already here, so don't blame that on the thought of universal or single payer. They're already here. So anyway, that's just sort of an enhancement overall on my idea. But again, the bottom line is I can't conceive that every working person pays a reasonable and fair share and that we can't, through that, take care of everybody. There are always going to be people that unfortunately have, no job, or are pay no taxes because of that. Do we throw them in the trash over that? I don't think so. So anyway, that's just my again, my thought on the whole thing, and whether we'll ever see any change in my lifetime, who knows? But it would be welcome. I would socialize healthcare in a second if it was up to me. Thanks.